Good afternoon. This is All India Radio. I am Anuja Kumar and with me is Abhishek Mukhopadhyay with the Midday News. The headlines. Prime Minister Narendra Modi interacts with the state chief ministers to discuss the various aspects of the ongoing lockdown. Health Minister Dr. Harshvardhan says the COVID-19 situation is now improving. Recovery rate of patients goes up to around 22%. King George Medical University in Lucknow becomes the first government hospital in the country to successfully launch the plasma therapy treatment for COVID-19. A batch of 391 students from Assam returned to Guwahati this morning from Kota. In Jammu and Kashmir, 3 terrorists killed in an encounter with security forces in Kazigund this morning. And United Nations warns millions of people will starve globally if there is a cut in funding for food. Prime Minister Narendra Modi today held a video conference with state chief ministers to discuss various aspects relating to the COVID-19 situation. Issues related to graded exit from the ongoing lockdown were understood to have been figured in the discussion. Among those present at the interaction include Home Minister Amit Shah and Health Minister Dr. Harshvardhan. Our correspondent has filed this report.
This is the Prime Minister's third video conference with the Chief Ministers after the announcement of nationwide lockdown last month. The last video conference was held on 11th April when several Chief Ministers had suggested Mr. Modi to extend the initial 21-day lockdown. 3 days later, the Prime Minister announced that extension of lockdown till 3rd of May. In his monthly Mann Ki Baat radio address yesterday, the Prime Minister said the country is in the middle of a war and asserted that people have to continue being careful and take precautions. His note of caution came amid gradual exemptions being granted by the centre and state to revive economic activities. Centre and the states have been giving gradual exemptions to boost economic activities and to provide relief to people. With Suparna Saikia, Anupam Mishra, AR News, Delhi.
The recovery rate of COVID-19 patients in India has improved to around 22%. Currently, the mortality rate of such patients is 3.1% in the country compared to 7% at global level. This was stated by Health Minister Dr. Harshvardhan yesterday while visiting the Trauma Centre of All India Institute of Medical Sciences, New Delhi, to take stock of the preparedness to overcome COVID-19. The minister added 5,913 people have been cured till now.
सारे दुनिया का एवरेज ग्लोबल एवरेज जो है वो 7% है तो हमारा आज भी 3.1% बना हुआ है। पिछले 3 दिन का अगर मैं डाटा की बात करूं तो अगर 14 दिन के अंदर हमारा डबलिंग रेट 8.1 था तो पिछले 7 दिन के अंदर वो डबलिंग रेट हमारा 9.3 हो गया और अगर पिछले 3 दिन के डबलिंग रेट की मैं बात करूं तो ये 10.5 है। यानी लगातार हमारी जो देश में स्थिति है वो इम्प्रूव होती जा रही है।
Continuing his update about the COVID-19 situation, Dr. Harshvardhan said, as on date, 283 districts have not reported any COVID-19 cases till date and 64 districts have not reported a fresh case since the last 7 days. Elaborating on the adequacy of the ventilators, oxygen supplies and ICUs, the Health Minister said,
2 लाख से ज्यादा बेड्स और इसी प्रकार से बहुत बड़ी संख्या में आईसीयू के बेड्स इनका इंतजाम सारे देश के अंदर हम लोगों ने किया है। पर्याप्त मात्रा में पीपीई किट्स, N95 मास्क और वेंटिलेटर्स की व्यवस्था की है।
Comparing the number of active patients who are currently hospitalized, only 2.17% patients have been admitted in ICU, 1.29% patients have required oxygen support, and mere 0.36% are on ventilator.
The number of COVID-19 cases in the country has climbed to 27,892, while the death toll rose to 872. Health Ministry data said the number of active COVID-19 cases stood at 20,835. As many as 6,184 people have been cured or discharged and 1 had migrated. Health Ministry said Maharashtra has the highest number of 8,068 cases, followed by Gujarat 3,301 and Delhi with 2,918 cases. Highest number of 342 people have lost lives in Maharashtra. Gujarat has reported 151 deaths, Madhya Pradesh 103 and Delhi 54 deaths. Plasma therapy has emerged as one of the important tools in treatment of COVID-19 patients. Countries like US, UK, China have started clinical trials of this treatment for patients of COVID-19. In India, it has been approved for clinical trials on COVID-19 cases by Drugs Controller General of India as per the protocol developed by the Indian Council Medical Research. Let us take a look at what is plasma therapy and how it is done.
Plasma therapy has been used in previous viral pandemics. It was very effective during the Ebola outbreak in Africa in 2018. The basic principle of plasma therapy is to use the immune power gained by a recovered person to treat a sick person. In this treatment, blood is collected from a person who has recovered from COVID-19 sickness. Then, the virus neutralizing antibodies are separated from the serum after screening. The convalescent serum, rich in antibodies against the novel coronavirus, is then administered to a COVID-19 patient. The patient thus acquires passive immunization. Vice-Chancellor of King George Medical University, Lucknow, Professor MLB Bhatt says the therapy is meant only for severely affected patients. The therapy is given only after getting informed consent of the patient. The success of the therapy in severe cases of COVID-19 has been a ray of hope for the mankind as the scientists are working overtime to develop a vaccine to check the spread of the pandemic. Suparna Sekya, AIR News, Delhi.
The King George Medical University in Uttar Pradesh has become the first government hospital in the country to successfully launch the plasma therapy treatment for the COVID-19 patients. Our correspondent reports that the first dose of plasma therapy was given yesterday to a 58-year-old patient.
Vice-Chancellor of the KGMU, Professor MLB Bhatt, termed it a proud moment for university and said that we were preparing for the plasma therapy right from the approval from Indian Council of Medical Research. The plasma was already secured from 3 recovered COVID-19 patients who were treated at KGMU itself.
मेडिसिन विभाग के डॉक्टरों द्वारा हेमेटोलॉजी, ट्रांसफ्यूजन मेडिसिन, माइक्रोबायोलॉजी डिपार्टमेंट और अन्य विभाग जो इसमें साथ में जुड़े हुए हैं, बायोकेमिस्ट्री डिपार्टमेंट, सबने मिल करके एक सम्मिलित प्रयास के तहत इस कार्य को किया गया। हम सभी इन चिकित्सकों को बधाई देते हैं उनके द्वारा इस बहुत ही अभूतपूर्व कार्य करने के लिए और उन मरीजों को भी धन्यवाद करते हैं जिन्होंने प्लाज्मा डोनेट किया ताकि ये प्लाज्मा थेरेपी का कार्य विश्वविद्यालय में प्रारंभ किया जा सके।
Assistant Professor of the Medicine Department, Dr. D. Himanshu said that the 58-year-old COVID-19 patient who was on ventilator has shown signs of recovery and second dose of the plasma transfusion therapy can be given today.
आज प्लाज्मा ट्रांसफ्यूजन के बाद इनके हालत में सुधार दिख रहा है और उनके बाकी पैरामीटर्स जितने हैं वो स्टेबल हुए हैं और वेंटिलेटर पैरामीटर्स भी अब धीरे धीरे कम किए जा रहे हैं। उनकी स्थिति देखते हुए आज हम लोग फिर से हो सकता है शाम को उनका दूसरा डोज भी आज दे।
If this patient recovers successfully, then it will be a great step in treating the serious patients with the help of plasma transfusion therapy. Sushil Chandra Tiwari, AIR News, Lucknow.
In our series Experts Speak on All India Radio, we bring you the views of some leading medical experts on COVID-19. Talking to AIR News, Dr. Amar Chand Bajaj, Senior Consultant in Sitaram Bharatiya Institute of Science and Research, New Delhi, spoke about the precautions one needs to take.
As we all know that till date, the perfect treatment is not available in the form of vaccine or the medicine. So the major thing remains is the precaution. So how we all can do the precaution as a social distancing. Unless and until it's very important, don't try to leave your home. Keep yourself under lock in your house. So what are the important things like medical emergency? To go buy for your daily needs things like grocery, milk or vegetables, yes, you will need to go outside for that. So even if you need to go outside for all those, space is there, try to be 2 meters away from each other, not at least 1 meter. Now if you talk about the mask, nowadays if whenever we're out of our house, we all should wear the mask. Common public should not use the N95 mask, a common mask which you can prepare at the home or even the normal surgical mask, and you should wear it whenever you're stepping out of your home. Now the third thing is the hand hygiene. Whenever we're outside the house, we should keep our hand hygiene at the topmost level. And don't try to touch your face when you're outside the home. If you're touching in the grocery shop or the vegetable shop, so make your habit from the home only that will not touch your face.
Dr. Sarita Gulati, senior cardiologist in Manipal Hospital, New Delhi, told about the extra measures the cardiac patients and people with high blood pressure need to take.
The cardiac patients, people suffering from high blood pressure, diabetes and kidney disease are more vulnerable. They should be taking extra precautions. They should continue with their regular medications. In case they have any problems, they can contact the doctors on video conferencing, which are available at many hospitals. If there is a fever, breathing difficulty, cough, they should seek medical advice immediately. Do not be afraid of this disease. In short, taking preventive measures are the most empowering help to fight this disease.
News just in. Prime Minister Narendra Modi today said that the lockdown due to COVID-19 pandemic has yielded positive results as the country has managed to save thousands of lives in the past 1.5 months. He said this while interacting with chief ministers of states via video conferencing to discuss the emerging situation and plan ahead for tackling the pandemic. This was the fourth such interaction of the Prime Minister with the chief ministers. Mr. Modi said India's population is comparable to that of the combined population of several countries. The situation in many countries, including India, was almost similar at the start of March. However, due to timely measures, India has been able to protect many people. Mr. Modi, however, forewarned that the danger of the virus is far from over and constant vigilance is of paramount importance. The Prime Minister said that the country has seen 2 lockdowns till now, both different in certain aspects, and now there is a need to think of the way ahead. He said that as per experts, the impact of coronavirus will remain visible in the coming months. Reiterating the mantra of Do Gaz Duri, he said that masks and face covers will become part of people's lives in the days ahead. He added that under the circumstances, everyone's aim must be rapid response. He pointed out that many people are self-declaring whether they have cough and cold or symptoms, and this is a welcome sign. The Prime Minister said importance must be given to the economy as well as the fight against COVID-19. He emphasized on the importance of usage of technology as much as possible and also to utilize time to embrace reform measures. He emphasized on the significance of ensuring that more people download the Arogya Setu app to bolster the efforts of the country in the battle against COVID-19. He said reforms will have to be brought that touch the lives of common citizens. He also suggested that people associated with universities can be integrated on devising ways to fight the pandemic and strengthen research as well as innovation. Mr. Modi highlighted the importance for states to enforce guidelines strictly in the hotspots. He stated that the efforts of the states should be directed towards converting the red zones into orange and thereafter to green zones.
Fact-check unit of the Press Information Bureau has clarified in a tweet that central government is not mulling a reduction in retirement age of central government employees. The tweet was a response to an article printed on a web portal which claimed that centre is likely to reduce the retirement age to 50. In another tweet, PIB Fact-check busted a fake news doing the rounds on WhatsApp that claimed government is going to bring an act which will require all salaried persons to deposit 18% of salary. The tweet clarified that government is considering introduction of no such law and also advised people not to forward unverified information. A fact check was performed by PIB in Assam about a news published in Manipur claiming the district hospital in Tamenglong was suffering from a lack of infrastructure and equipment amidst the coronavirus crisis. The State Health Department had earlier rebutted the claim. You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi interacts with the state chief ministers to discuss the various aspects of the ongoing lockdown. Health Minister Dr. Harshvardhan says the COVID-19 situation is now improving. Recovery rate of patients goes up to around 22%. King George Medical University in Lucknow becomes the first government hospital in the country to successfully launch the plasma therapy treatment for COVID-19. A batch of 391 students from Assam returned to Guwahati this morning from Kota. In Jammu and Kashmir, 3 terrorists killed in an encounter with security forces in Kazigund this morning. And United Nations warns millions of people will starve globally if there is a cut in funding for food. For quick news updates around the clock, follow us on our Twitter handle at AIR News Alerts.
The Reserve Bank of India today announced a special liquidity facility for mutual funds, SLF-MF, of 50,000 crore rupees. This was done with a view to ease liquidity pressures on MFs. The RBI has stated that it remains vigilant and will take whatever steps are necessary to mitigate the economic impact of COVID-19 and preserve financial stability. The RBI said in a statement that the heightened volatility in capital markets in reaction to COVID-19 has imposed liquidity strains on mutual funds, which have intensified in the wake of redemption pressures related to closure of some debt, MFs and potential contagious effects therefrom. The stress is, however, confined to the high-risk debt MF segment at this stage, and the larger industry remains liquid. A report.
The Apex Bank has said that under the Special Liquidity Facility for Mutual Funds, that is SLF-MF, the RBI shall conduct repo operations of 90 days tenure at the fixed repo rate. The SLF-MF is on tap and open-ended, and banks can submit their bids to avail funding on any day from Monday to Friday. The scheme is available from today, that is April 27, 2020 till May 11, 2020, or up to utilization of the allocated amount, whichever is earlier. The Reserve Bank has said it will review the timeline and amount depending upon market conditions. With Sonali Ghadial Patil's report from Mumbai, Anand Srivastav, AIR News.
In Assam, a group of students who were studying at Kota have arrived in Guwahati early this morning. Health Minister Himanta Biswa Sarma and Minister of State for Health Piyush Hazarika welcomed them at Saru Sajai Stadium. The Assam government had made the arrangement to bring back 391 stranded students. All of them are now put on mandatory quarantine. Our Guwahati correspondent reports that out of 35 positive cases, 27 patients have been cured and discharged from hospitals so far in the state.
In Arunachal Pradesh, many NGOs and people of Daporijo town in Upper Subansiri district are coming forward to help commuters who are travelling to other districts via Daporijo. They are providing them with foods and refreshments on the roadside. After the state government issued passes for many stranded people in the capital city Itanagar and other districts to move to their hometowns, these commuters are taking the interstate roads via Daporijo, avoiding the NH15 which is in Assam. In Bihar, additional 21 companies of the Bihar Military Police BMP have been deployed in the containment zones in several districts after spurt of COVID-19 cases in the state. Director General of Police Gupteshwar Pandey said these companies are in addition to 32 companies which were earlier deployed for enforcement of the lockdown across the state. 2 SP rank officers, each in Siwan and Munger, have also been deployed for monitoring of containment zones. Positive cases of coronavirus in the state have been mounted to 290. Maximum 81 positive cases are from Munger district. 56 patients, including 3 women, have so far been discharged from hospitals. 2 deaths have been reported from Munger and Vaishali districts. In all, 232 patients are undergoing treatment in different hospitals.
In Madhya Pradesh, the total number of COVID-19 cases have gone up to 2,120, with 175 new cases reported in last 24 hours. While 302 patients have been cured and discharged from various hospitals, 103 patients have lost their lives so far. As per the State Health Department bulletin, the condition of 1,650 patients is stable, while 35 patients are on ventilators. AIR News Bhopal correspondent reports that Indore city has become the hotspot of COVID-19, where the total number of cases has gone up to 1,207.
Indore and Bhopal continue to be a cause of concern for the government. The number of infected people is continuously increasing in these 2 cities. The number of patients in the capital Bhopal has risen to 415. Good news is also coming from Indore and Bhopal, where a large number of patients are recovering daily and they are being discharged from the hospitals. More than 30 people have also been discharged from the hospitals yesterday. In Morena too, all 13 corona-positive patients have recovered completely. Meanwhile, PPE kits are available in the surplus for corona warriors in the state. Managing Director of State Industrial Development Center, Kumar Purushottam, informed that 10,000 PPE kits are required daily in the state, whereas 12,000 kits are being made every day. Sanjeev Sharma, AIR News, Bhopal.
Maharashtra has already crossed the 8,000 mark in corona-positive patients, while 342 deaths have been reported in the state till date. The State Health Department has said the mortality rate stands at 4.24%. On the positive side, blood samples of 4 COVID-19 survivors have tested positive for antibodies. Their plasma will now be used to treat other patients. The Brihan Mumbai Municipal Corporation has appealed other patients also who have recovered from coronavirus to come forward and help others recover by opting for plasma donation. More from our Mumbai correspondent.
The Mumbai Municipal Commissioner visited the MMRDA exhibition grounds at BKC for a site survey so that if needed, the ground may be used to set up additional quarantine and isolation facilities. In a positive story of the lockdown period, major hotspot zones of air pollution in Mumbai city have now been declared green zones. The regions, Warari, Borivali and Bhandup have recorded very less or almost zero level of air pollution. With most people working from home, home guards have now come forward to help people facilitate this. In yet another inspiration story, a 3-year-old girl from Dahanu in Palghar district was cured of coronavirus infection. The child was sent home on Sunday. Sonali Ghadiyar Patil, AIR News, Mumbai.
In Gujarat, Women and Child Development Ministry has taken a unique initiative called Umbare Anganwadi, that is Doorstep Anganwadi, to reach out to children during the lockdown. Our correspondent reports that under the ICDS program, the government has not only ensured the nutritious food to the children, but also ensured their overall development. Our report.
The ICDS department has launched a TV program called Umbare Anganwadi, which is telecast every alternate day through Vande Gujarat channel as well as through GeoTV. Same is also telecast on YouTube. Talking to AIR, the Deputy Director ICDS Ilaba Rana said the regular theme-based modules of Anganwadis are being taught in an interactive way in the program which children can watch with their parents. Apart from this, various experts teach different art and craft activities in the program which children can make from the home-based resources during the lockdown. She added that the program is targeted to around 14 lakh Anganwadi children in an age group of 3 to 6 years old. In view of COVID-19, department has also distributed ready-to-eat nutritious food packet by Amul to its beneficiaries including children, pregnant women, adults and girls through the network of around 53,000 Anganwadis. Aparna Khund, AR News, Ahmedabad.
In Rajasthan, the number of COVID-19 infected persons has gone up to 2,221 with 36 new persons found positive today. 9 cases have been reported from Jaipur and Jhalawar. Our correspondent reports that the prisoners in jails are also significantly contributing in the ongoing fight against corona.
2 lakh masks have been prepared so far by the state jail staff and prisoners in jails during COVID-19 crisis. Mask manufacturing work is going on in 12 jails of the state including Jaipur. Apart from this, prisoners are also preparing sanitizer by setting up a factory in Sanganer Open Jail. 30,000 liters sanitizer has been prepared and supplied so far. Deputy Inspector General of Jail Department Vikas Kumar told that at such a time, every little contribution is important for the safety of the society. The contribution of prisoners has proved that whenever the country faces any challenge, every citizen automatically comes forward for help, whether he is common or special. Jitendra Dwivedi, AIR News, Jaipur.
In Chandigarh, 2 doctors and a ward servant of Sector 32 hospital have been tested positive for COVID-19 today. With this, the number of corona-positive patients found positive so far has risen to 39. Our correspondent reports that 17 positive patients have been cured and discharged from hospitals. Now the number of active COVID-19 patients has risen to 22. The Chandigarh administration has sealed the borders with other states in view of positive cases reported regularly from last 4 days. In Chennai, the 5-member interministerial central team led by the Additional Secretary in the National Disaster Management Authority, Dr. Tirupurgar, are meeting the Chief Minister this afternoon. They will also review the situation with the State Health Secretary and other senior officials. More from our correspondent.
For the third day today, the interministerial central team members are inspecting various facilities in Chennai. They reviewed the distribution of essential materials to the public within the containment zones in the city and the daily home surveillance activities there and the disinfection works this morning. Later, they visited a ration shop, a children's home and the city corporation's relief materials collection and distribution center. They reviewed the social distancing norms being followed there and the sanitary measures being undertaken. They wind up the day's activities by meeting the state chief minister and the secretaries of various departments. As Chennai carries the biggest disease burden with consistently higher number of new cases every day for the past many days, the team is reviewing the ground situation there. Meanwhile, the city along with Coimbatore, Tirupur, Salem and Madurai are under complete lockdown since yesterday. Jai Singh, AR News, Chennai.
In Karnataka, South Western Railway distributed 2.26 lakh meals to the poor, daily wage earners and migrant workers during the COVID-19 lockdown period. Bengaluru, Mysuru and Hubli division of South Western Railway continues to provide hot cooked food to the needy people through base kitchens of IRCTC with the help of Railway Protection Force, department staffs and NGOs. Apart from this, the railway also is distributing groceries to the migrant workers.
Kerala is making extensive preparations as it expects evacuations of people from the Gulf region by operation of special flights to begin after the 3rd of May or as and when the lockdown is withdrawn.
Chief Minister Pinarayi Vijayan reviewed the preparations and arrangements made by the district administration to quarantine the persons arriving from the Gulf region and other states. Kerala anticipates a return of nearly 4.5 lakh of Malayalis within 1 month once the union government begins the evacuation. The state has set up COVID care homes near airports and directed all districts to quarantine people returning from abroad and other states. Meanwhile, the NORCA, Non-Resident Keralites Affairs, has commenced the registration for individuals in Gulf region who wants to return to Kerala amid COVID outbreak. People with medical issues other than COVID-19, pregnant women, those with expired visas, people stuck after going on visiting visa are given major priority. Meanwhile, 123 active cases are there in the state presently. A total of 342 persons recovered from the disease so far in Kerala. The number of people under observation went down to around 20,000. Mayusha for AR News from Thiruvananthapuram.
Union Minister Prakash Javadekar today said that the world has come together to fight COVID-19 and similar global efforts are needed to combat climate change. In his message for Petersburg Climate Dialogue, Mr. Javadekar said COVID-19 has taught that countries cannot act separately as the future is linked and everyone has to work together. He said it is common responsibility to mitigate the challenges of climate change.
First time in the history, the Petersburg Dialogue is taking place on video. But this is new technology and we have to use more and more. COVID-19 has taught us that we cannot act separately. Our future, our present is linked to each other and we have to work together. The second lesson is it's our common responsibility to mitigate the challenge of climate change. We need to work together. That is what India's stand is.
Head of the World Food Programme, David Beasley, has asserted that the coronavirus pandemic is not only affecting the world's rich economies, but also impacting the economies of vulnerable and conflict-torn countries. He added millions of people in these countries will face starvation if there is a cut in the United Nations agency's funding for food. He said that maintaining supply chains is critical and there are many potential obstacles: export restrictions, closed borders and ports, farms not producing and roads closed.
Amid coronavirus pandemic, our correspondent spoke to people about the benefits they have availed under various central government schemes. Kumar Chetri from Itanagar in Arunachal Pradesh expressed gratitude towards the government for providing free rice under PM Garib Kalyan Yojana.
अभी जिस लॉकडाउन का टाइम है पेमेंट उमेंट भी जल्दी नहीं मिल रहा है. मेरा तो 7 मेंबर है, 35 किलो मिल रहा है, तो कम से कम महीना भर का तो चावल तो फ्री मिला है. इसके लिए हम गवर्नमेंट को भी थैंक यू बोलते हैं.
In Jammu and Kashmir, 3 terrorists were killed in a fierce gunfight that broke out between terrorists and security forces at Lower Munda area of Kazigund this morning. Public Relations Officer Defence in Srinagar, Colonel Rajesh Kalia said that a joint team of Army's 19 Rashtriya Rifles, Special Operation Group and Central Reserve Police Force laid a cordon and search operation at Lower Munda following the inputs about the presence of some terrorists there. The joint team intensified searches at around 8 a.m. and the hiding terrorists opened indiscriminate fire, leading to an encounter that resulted into the killing of 3 terrorists. And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi interacts with the state chief ministers to discuss the various aspects of the ongoing lockdown. Health Minister Dr. Harshvardhan says the COVID-19 situation is now improving. Recovery rate of patients goes up to around 22%. King George Medical University in Lucknow becomes the first government hospital in the country to successfully launch the plasma therapy treatment for COVID-19. A batch of 391 students from Assam returned to Guwahati this morning from Kota. In Jammu and Kashmir, 3 terrorists killed in an encounter with security forces in Kazigund this morning. And with that, we end the midday news.